Thanks, Mark. Thanks for inviting me to give a talk. It's a pleasure to be here today. So I'm going to give you a bit of a snapshot of the Canadian Cannabis Survey, which was launched last year, in the spring of last year, and a unique survey that's never been done before in Canada. And there's a lot of data that was generated from the survey. I'm only going to be presenting a slice or a snapshot of that because there's just not enough time to get into it all. So I think Eric mentioned earlier about the importance of monitoring and surveillance. And I think that back in 2016, the federal government put together a task force to advise the government, to provide advice and recommendations to the government on how to develop a regulatory framework for legalizing and regulating cannabis in Canada. And in that report, which contained over 80 recommendations, one of them was, and it kept being repeated over and over in the report, was the importance of gathering baseline data and but before any change, as well as the importance of continuing to gather that data after a change in the legislation. And this is really important because proactive data collection, monitoring, surveillance, and analysis both before and after legalization is going to be valuable for a lot of different things. It's valuable for monitoring the health and safety impacts of legalization, as Eric mentioned earlier. It's important for developing policy and regulations. It's also important for modifying policy and regulations in response to something we're seeing that's coming from the data we're collecting. And lastly, it's important, really important for public education and awareness. Now, the federal government is engaged in a lot of different activities on the surveillance and research side, but I'm only going to be talking today about the Canadian Cannabis Survey. So what was the objective of the Canadian Cannabis Survey? Well, the main goal was to obtain detailed information about the knowledge, attitudes, and behaviors of Canadians who use cannabis for non-medical purposes and medical purposes, and also to collect information about the perceptions of non-users. Now, a really important caveat to this survey is that unlike general population surveys that we run, like the Canadian Tobacco, Alcohol, and Drugs Survey and the Canadian Student Tobacco, Alcohol, and Drugs Survey, this survey was not intentionally designed to estimate the prevalence of cannabis use, and that's because the way that the survey was done introduced some caveats into that. So the data that I'm going to be presenting is not to be taken as this is the prevalence of cannabis use in Canada, so please keep that in mind. So the Canadian Cannabis, that didn't work, there we go. The Canadian Cannabis Survey was in the field in the spring of last year for about 2 months, from March to May. It collected data from slightly over 9,000 people, 16 years of age and older. And the survey results were released in December of last year. And there's a lot of data available online, and you don't have to copy the links here. You can just type into Google Canadian Cannabis Survey 2017. You'll get to the page that you need to get, but all the data is available from the Library and Archives website, as well as a summary report available on the Health Canada website. Oops. So a little bit about the methodology of the report, of the survey, sorry. So respondents were first recruited by telephone using both landline and mobile technology using random digit dialing, which is pretty standard for surveys. Respondents who completed the screener questions, and in this case the screener questions were, are you a Canadian citizen, and are you above the age of 16, and are you interested in completing a survey about cannabis? So people knew that they were going to be asked whether they wanted to complete a survey about cannabis use or not. So those folks who agreed and who qualified were then sent a link by either text message or email so they could go online and complete the survey there. The data were weighted on region, age, and sex, so there's not provincial data. There's no provincial data that we have right now. We have data based on regions, but it's hoped that going forward we'll be able to get more provincial data. And importantly, at the end of the survey, respondents who had reported using cannabis for medical purposes were also asked if they wanted to complete an additional module of the survey, getting more information about their use of cannabis for medical purposes. Right, so as I mentioned, a total of 9,215 respondents participated in the survey, and the vast majority, like 6,565 of the respondents were people who said that they had not used cannabis in the last 12 months, with the remainder, 2,650, saying that they had used cannabis either for medical or non-medical purposes in the last, either for medical or non-medical purposes. Okay. So, in terms of the structure of this survey, so it's basically the survey was broken down into 4 major themes. Knowledge, attitudes, and behaviors of all of the respondents, so that's users and non-users. Details regarding their patterns of use and sourcing, so where are they getting their cannabis, how much are they paying, and so on and so forth. Driving and cannabis use, and lastly, the use of cannabis for medical purposes. So in terms of knowledge, attitudes, and behaviors, so we asked respondents to tell us about how socially acceptable did they think it was to use alcohol, to smoke cannabis for non-medical purposes, and to use tobacco occasionally. And generally speaking, a significant number of respondents, 56%, said it was, so that's all respondents, users and non-users of cannabis, said it was completely socially acceptable to occasionally use alcohol. Where the data gets a bit more interesting is when you look at cannabis users, and amongst those, you see that there's a higher proportion of respondents who said they used cannabis for non-medical purposes, who said that they thought it was completely socially acceptable to use alcohol occasionally. And that similar pattern is, of course, evident when they were asked how completely socially acceptable is it to use to smoke cannabis. Obviously, they said it was acceptable. And tobacco, there was a higher proportion of cannabis users who said it was completely socially acceptable to occasionally use tobacco. So we also delved further into respondents' opinions on the effects of cannabis. So the majority of all survey respondents thought that using cannabis could be habit-forming. And what was interesting was that proportion was greater amongst non-users compared to those who had said that they used in the last 12 months. Interestingly, about half of respondents, of all respondents, indicated that they believed cannabis had a positive effect on a number of things, such as a person's mood, their creativity, their anxiety, and their sleep. But a greater proportion of respondents believe that cannabis also has a negative effect on a person's motivation and ambition, on their memory, on their concentration, attention, thinking, and decision-making. When we further asked people who had said that they used cannabis in the last 12 months, what they thought their effects on various aspects of what the effects of cannabis use on various aspects of life were for them, a significant proportion said that for a number of things there was no effect. So no effect for physical health, no effect on physical mobility, no effect on home life or marriage, or no effect on work or studies. However, a significant proportion of those who used cannabis in the last 12 months said that it did have a positive impact on their friendships or social life, on their mental health, and on their quality of life. So in terms of, we then went to module 2 or part 2 of the survey, patterns of use and sourcing. So what we found was that the average age of initiation to cannabis use was 18.7 years, and that's pretty close to what we see with our standard general population survey, CTADS, 18.4, so consistent there. We also found that students were more likely to report using cannabis products in the last 12 months compared to people who were working, unemployed, retired, or not in the workforce. And those who had completed some high school reported, as their highest level of education, reported the highest use of cannabis compared to others. When we looked at the proportion of all respondents who reported past 12-month non-medical use, what we saw was that amongst all respondents, that was 22% of all respondents said that they had used cannabis in the past 12 months, with 78% saying they hadn't used cannabis in the last 12 months. And amongst, when we break it down by age group, actually, I should say that there was a preponderance of more males reporting past 12-month use than females, which is consistent with other surveys. And in terms of age groups, as we've heard before, youth and young adults are the ones that are reporting a greater proportion of cannabis use compared to those who are 25 and over. Is that the right one? Yeah, okay. So when we asked respondents who had used in the past 12 months what their frequency of cannabis use was, what we found was that the majority, and I'm going to combine less than a day per month, 1 day per month, and 2 to 3 days per month. So most folks said that they had used 3 days per month or less. But there was a substantial proportion, almost 20%, who said that they were using daily. And when we further asked people who had used cannabis in the last 30 days, how frequently they used cannabis on the days that they used cannabis in the last 30 days, that's a little tricky. The majority said that they had used one time, but there was also a number of folks, 20%, who said they used twice, and a number of folks who used more than that per day. 13% said they used 5 times or more on the days that they used cannabis. When we looked at methods of cannabis consumption, it's pretty consistent data with other surveys that have been conducted, which is the most preferred method of using cannabis is smoking. Almost all respondents said that they used cannabis by smoking. However, about 30%, a little over 30% said that they were eating it in food, with about 1 in 5 saying they vaporized it using a vaping pen or vaporizing it using some other type of vaporizer. We also saw about 11% of respondents saying that they dabbed cannabis, so that's the use of high potency concentrates. When we examined sources of cannabis, so where Canadians, where respondents getting their cannabis from, so it was interesting because most users, like 52%, reported obtaining their cannabis from a single source or person over the last 12 months, and a really small minority, 2%, said that they grew their own cannabis. Consistent, or I should say, the next one's consistent, but this one's, the 4 most commonly identified sources, or usual sources, were somebody that was close to that person, so either a family member or a friend at 26%, or shared among a group of friends, 24%. And that's common to what we know about how people use cannabis and where they get it from. And the most commonly identified locations to obtain cannabis were, and this is consistent with the previous bullet that I just mentioned, which is somebody else's home. So if you're getting it from a family member or friend, you're probably getting it in their home. I should say that only 13% said a Compassion Club, school, university, college, 5%, so a pretty small number. A Health Canada licensed producer, 4%, pretty low. In terms of how much were people spending per purchase for cannabis and monthly. So we asked those questions, and what we found was in the last 30 days, the average price that somebody paid per gram of dried flower or leaf was $11.40, and that was for when they purchased it and not, of course, gotten it for free from someone. The proportion of people who got it for free was about 17%. Now, the average amount spent on cannabis, dried flower and leaf for non-medical purposes in the past 12 months was $75. Now, just remember that number, because I'm going to talk about it when I get to medical purposes, and you'll see there's a significant difference in the amount paid, or in the amount spent per month on cannabis for medical purposes. So then we asked questions about driving and cannabis use. So one important question was asking folks, what's your perception of whether cannabis affects your driving? Do you think it has an effect? No effect? Does it depend on something? So what we found was that a majority of respondents said that cannabis did affect driving. What's really interesting is that when you ask cannabis users, people who used in the last 12 months, whether cannabis affects their driving, you only get about 50% who say it does. But if you ask non-users, you see 82% of respondents said that it does affect their driving. So it's quite a staggering difference in their perception of whether cannabis affects their driving or not. 20% of past 12-month cannabis users said that cannabis didn't affect their driving, and about a quarter said that it depended on certain things. We then asked the respondents when they thought it was safe to drive after using cannabis. And the most common response, 36%, was it depends. It depends on a person's tolerance, it depends on the person's weight, and it depends on how much the person's used. And interestingly, about a fifth or so of respondents said they didn't know when it was safe to drive after using cannabis, so suggesting quite a lack of knowledge around what's the appropriate time after using cannabis that it's okay to get behind the wheel of a car. Then we asked questions about patterns of behavior around driving after cannabis use. So 39% of the respondents who had used cannabis in the last 12 months reported having ever driven within 2 hours after using cannabis. And of this 39%, about 4 out of 10 said that they did this in the last 30 days. 1/3 said that they did this in the last 12 months. And 15% of those reported that they had combined cannabis and alcohol within 2 hours before driving, and 8% said that they had driven within 2 hours of using cannabis combined with other drugs. When we asked respondents about their behaviors when they get into a car with somebody who's used cannabis, not themselves, but somebody who's used cannabis, 39% of all the respondents to the survey, so that's users and non-users, reported they had been in a vehicle driven by somebody who had used cannabis within 2 hours of driving. And, oh, I'm so sorry. Thank you. Thanks so much. Yep, that's the right slide. Thanks, Mark. And 23% of these reported doing so in the last 12 months. And perhaps not surprisingly, this behavior was more common amongst cannabis users, almost 80%, compared to non-users, at 27%. So the last part of my presentation is going to be about cannabis for medical purposes. So we found that about 12% of all respondents to the survey said that they had used cannabis for medical purposes in the past 12 months, with the vast majority, 88%, saying they hadn't. And in terms of age groups, what we saw was that there was a greater proportion of individuals between the ages of 16 and 19 and 20 and 24 who said they used cannabis for medical purposes, compared to those who were over the age of 25. So diving into that data a little bit more deeply, so about 8 out of 10 respondents to the medical cannabis modules said that, said that they used cannabis for medical purposes in the last 12 months, also reported using cannabis for non-medical purposes during the same time period. And that's consistent with what we've seen from other surveys, saying there's an overlap between medical use and non-medical use. Surprisingly, only, or maybe not surprisingly, only about a third of respondents who used cannabis in the last 12 months said that they had a medical document from a healthcare professional to use cannabis for medical purposes. And again, surprisingly or perhaps not surprisingly, only 1/5 of respondents who had used cannabis for medical purposes in the past 12 months said that they accessed cannabis through the Health Canada Access to Cannabis for Medical Purposes program. Almost all folks who said that they used cannabis for medical purposes reported that cannabis helped to manage their symptoms and disease. And 7 out of 10 said that it helped them decrease their use of other medications, which is consistent with some other data that we're seeing. I remember that number I was telling you, $75 a month for people who were spending on cannabis for non-medical purposes. Respondents who were spending money on cannabis for medical purposes said that they spent $121 a month to purchase cannabis for medical purposes, so quite a bit more than for non-medical purposes. We then asked some questions of people who said they used cannabis for medical purposes and their behaviors around driving. And 4 out of 10 who reported using cannabis for medical purposes and who completed the medical section of the survey said they believe using cannabis for medical purposes impairs their ability to drive, with about 1/3 saying it didn't, and again, almost about a third, or actually a little bit more than a third, saying that it depended on some factors. When we asked them when they thought it was safe to use cannabis after, to drive after using cannabis for medical purposes, a third said it depends. 21% or 1/5 said 1 to 3 hours. 14% said 3 to 5 hours, and 7% said it was safe to drive right after using. And I think this is my second to last slide. So 4 out of 10 respondents who reported using cannabis for medical purposes and who completed that section of the survey said they had driven within 2 hours of using cannabis for medical purposes. And 4 out of 10 said that they had done so in the last 12 months between 1 and 10 times. And about 37% said they had done so they had driven more than 10 times in the past 12 months within 2 hours of using cannabis, so a substantial number. And then 10% of respondents who had used cannabis for medical purposes in the last 12 months and who had driven within 2 hours of using cannabis had said that they had driven while using cannabis in combination with alcohol. So I'm just going to wrap it up. So essentially, the Canadian Cannabis Survey yielded a huge amount of data, and I've only kind of given you the tip of the iceberg. There are about 70 tables of data available on the Library and Archives website. So there's a lot of data that was gathered from this survey. So we're examining the possibility of repeating this survey in the next little while before legalization, to basically have 2 data points ahead of before legalization. And of course, our intent is to hopefully also carry this forward after legalization to monitor the impact of the change in the legislation. And it's quite likely that for consistency purposes, the next cycle of the survey is going to be very similar to the first one, but we've learned a few things about what questions yielded good data versus what questions didn't yield any useful data at all. So we might adjust accordingly to streamline the survey in some way, but it's important to keep a lot of things consistent. Otherwise, if you change too many things, you won't get a reliable, consistent data. And there's an interest from some to oversample specific population groups, and the feasibility of this is being examined. So with that, I will conclude, and thank you very much for your attention.